we have for our first presentation Dr. Preeti Kumari will present state of mental health among glaucoma patients, an issue that needs to be addressed beyond routine glaucoma care.
Yes.
Sounds interesting.
Good afternoon, everybody. I am Preeti Dubey here. I am talking on the state of mental health among glaucoma patients. Starting with the introduction, glaucoma is a progressive degeneration of the optic nerve head resulting in visual field defects. It is the leading cause of irreversible blindness globally, and it is often referred as silent thief of sight. The psychological impact of chronic vision-threatening disease is often overlooked in regular eye care. Coming on to the current situation, in India alone, there is 12 million people who have glaucoma, and we have found three main problems. First is a healthcare gap, that is, the eye care focused solely on the physical symptoms. The second is there is bidirectional relationship, that is, the mental health and glaucoma affect each other, vice versa. And the third problem was care fragmentation, that is, the eye care facility and the mental health services remain disconnected. We did this study for following reasons. We found a profound impact of glaucoma on both the physical and psychological well-being. Anxiety and depression are common comorbidities in every chronic disease, and there is limited research over this topic in India especially. And we need to understand the contributing factors to tailor the interventions. Coming on to the aims and objectives. The aim is to determine the association between glaucoma and depression anxiety disorders. The objectives are, first is to determine the relationship between the depression anxiety with severity and duration of glaucoma. The second being the association between the depression anxiety disorders and compliance to glaucoma treatment. Next, the methodology. This hospital-based cross-sectional observational study was conducted in Department of Ophthalmology in SNMC Agra. Total 180 patients were studied between duration of November 2022 to April 2024. Ethical approval was obtained. The criteria: we included all the glaucoma patients over 18 years of age. Exclusion criteria were glaucoma with any other chronic eye disease, or the patients already on psychotropic medications or pre-existing mental health diagnosis were excluded. Patient with substance abuse or whosoever declined participation were excluded. Assessment. Complete ocular examination was done. For psychiatric assessment, we used Hamilton Depression Rating Scale and Hamilton Anxiety Rating Scale, that is HAM-D and HAM-A. Coming on to the results. Demographics. Of our patients, 60% were males and remaining 40% were females. Most were between in the age group of 40 to 59 years. Prevalence of depression and anxiety. We found depression was diagnosed in 17% of the patients, where 13% showed the mild symptoms of depression and 3% showed the moderate symptoms of depression. Anxiety was diagnosed in about 7% of the patients in our study, which was evenly split between mild and moderate symptoms. Coming on to the gender-based distribution, depression was more common among the female glaucoma patients, while anxiety was more prevalent among the male glaucoma patients. Coming on to the glaucoma severity and psychological disorders, we found a strong connection between the glaucoma severity and the mental health issues. As we can see, the half of all the patients with the end-stage glaucoma had depression. Similarly, anxiety was much common in patients with the advanced glaucoma. Coming on to the clinical characteristics and the psychological disorders, we found the patients with depression or anxiety had worse indicators of glaucoma severity. Both were associated with significantly higher CDR, lower VFI. Both conditions were associated with more medication use. Surprisingly, the duration of glaucoma was not significantly different in either condition. Treatment compliance and psychological disorder. 60% of the glaucoma patients with depression were not taking their medications properly, compared to only 26% without depression. Surprisingly, the anxiety didn't seem to affect the compliance, as 75% of the anxious patients still took their medications properly. Key findings of my study is prevalence. As earlier discussed, 16.6% showed depression symptoms and 6.6% showed anxiety symptoms. Disease severity, significant association between the severity of glaucoma and depression and anxiety were found. 50% with end stage had depression, 29% of the patient with end stage had anxiety. Coming on to duration of disease, there was no significant association between duration of glaucoma and depression anxiety. Treatment compliance, depression associated with poorer treatment compliance, while anxiety did not significantly impact the compliance. The clinical implications of the study are holistic approach. We should target the high risk groups and we should improve the compliance, which may improve the quality of life of these patients. The recommendations are regular screening for depression, multidisciplinary care, that is collaboration between psychiatrist and the ophthalmologist is needed. Patients should be educated and further research to establish a causal relationship has to be done. Thank you for listening. Have a nice day. Thank you, sir.
Great presentation. There's actually a scarcity of in the literature regarding depression.
Yes, sir.
It's quite interesting that those who have depressed it's a risk factor for non-compliance.
Yes, sir.
So how do you plan in terms of addressing that? For those with advanced glaucoma, would you suggest to have screening for depression and anxiety?
Yes, sir. So whenever these patients approach in the OPD, we can see that they are very apprehensive and they are always complaining of their insomnia, they have lack of sleep, or they have some genitourinary or some gastrointestinal symptoms also, which refer, or they don't have this feeling of pleasure in doing the things which they earlier used to. So we get it counseled from the psychiatrist. They apply this HAMD and HAME to just diagnose the severity of the depression or anxiety which is present, and then they counsel and give the required medication, sir. And we have seen that whichever patients we have referred to the psychiatrist, we have found the compliance has improved in these patients after proper counseling of these patients.
Yeah, that's great. It's a holistic approach.
Yes, sir.
Did you take out some other comorbidities that could add to the depression aside from ocular comorbidities?
Yes, sir. Diabetes has itself been, because in India it is not like, sir, not everybody is so blessed financially. So the chronic diseases are very hard on the pocket, sir. It seems like it is very easy to get these medications, but on a long run, it costs hefty on the patient. So any chronic disease, be it diabetes or simply hypertension, they cost very much to the patient, so they land up in depression.
Okay, so but you didn't take it wasn't an exclusion criteria.
No, sir, it was.
It was.
Yes, sir,
Okay,
yes.
so you took
Yes.
that. Okay, thank you very much.
Thank you so much, sir. Thank you,
Great
sir.
study. I hope you continue on. What's the question, sir?
Would it not be great to operate at least one eye of such patients?
Yes, sir. We should always consider them. Yes, sir. But yes, sir. As I discussed, that most of the symptoms of psychological disorders were found in end-stage glaucoma. So as there it is like snuff out phenomenon. So, sir, we like kind of prevent those eyesight which is there already.
So you can always operate one eye.
Yes, sir.
Yes, that's a very good point, sir.
Yes, sir.
But make sure that the depression is also
Yes, sir.
addressed, or else they won't use the post-operative medications,
Yes,
and
sir.
it's a vicious cycle.
Yes.
Okay,
Thank you
great.
so much, sir. Thank you for listening.
Excellent.